Okay, as everybody continues to filter in and get their food, I just wanted to let you guys know, first of all, thanks for being here. Secondly, we do have a number of people actually who are streaming in live to this, so I want to welcome them in as well to this event. It's kind of cool this day and age to be able to have people from outside in with us. So you guys who are there online, you're in the right spot. And we'll begin shortly, but again, we're still getting some food here, and these people are really hungry here. So we want to make sure we don't truncate that process. So we'll start shortly. Okay, they don't give me tons of time to do this, so we're gonna get going with our program now because I want to make sure that we can fit things in. So I'm gonna ask you guys just to quiet down, and we're gonna get started right now. It's okay to stay in line and keep getting your food and get back to your seats. That's no problem whatsoever. I'm just going to get this program rolling if that's okay. This is gonna be really casual. The goal of this is really to be a little bit interactive. So if these guys up here who are sitting up here, who are, now I know none of them would say I'm an expert, that's fine, but it does say Veterinary Ozone Panel of Experts. So you have to try, okay? Just at least try to be an expert. So if they start talking a little bit too much, though, I'm going to tell them to be quiet, and we're going to move on to the next question. So don't feel bad if I say that, though. It might happen. Okay? All right. So just a couple things before we get started, though. I'm, at the end of this, going to just give you a little bit on what we have available as O3Vets. The main goal here is information, so I'm not going to make this salesy at all. I want you guys to get some value out of this there. But if you do have questions that we don't cover, because I'm not going to really spend time on our equipment, our processes, what we do, how wonderful ozone therapy is from our perspective, and how great our company is. If you have questions, come by our booth and talk with us about that kind of stuff. That being said, again, I'll take a couple minutes at the very end just to mention a few things. If you want to, so we have a cool product just to start with. This is a sample pack, but I am not giving it away free. And I'll tell you why. Because we're a really small company. And it's hard for me to give stuff away and still make money, even little samples. So what I am going to do, though, is if people want to try this is an oral and a skin product that the active ingredient is ozone. If they want to try that, they can have one if they give us a reference of another vet who should be doing ozone therapy, just a phone number, a name, that's it. So I have a form up here. If you want to fill one out, you can take this with you. Fair enough? With that said, here's what we're going to do. I'm going to ask a few questions of these people up here, this lovely group. And I didn't have a slide with all of your guys' picture up here. So I'm going to just really briefly, we have Dr. Nunez, Al Nunez here on the end. He practices down in Florida. Exactly where, right in Orlando area? Right. Two practices in Orlando. Dr. Margot Roman, who is in Hopkinton, Massachusetts. Dr. Marlene Siegel, who is near Tampa, a little bit north, I believe, of Tampa, and Dr. Judith Shoemaker, who's in Pennsylvania and Nottingham, close to Philly. So we're not going to have time for real introductions, but I think most of you know these people know these guys anyway. I'm going to ask a few questions, and then once I've done that and we've worked through some of these things, I'm going to open it up to you guys. There's a mic right back in the middle of the room, kind of. And so if you have a question at that point in time, jump up and go over to the mic, and you guys can ask your questions. But I get to start. I have so many people telling me, oh, I didn't know you guys had a training. We always have a training in conjunction with this conference. 2 days before this conference starts, we have an ozone therapy training class. We do it at the same place, okay? So just if you are interested in the future, you can know that that's going to take place. We also have some other ones. We have one in April in Orlando, going to be happening as well, and we're doing some online stuff as well. So if you haven't signed up for getting emails so that you know when that stuff is taking place, do that at our booth or give me a card here, and I'll get you on our mail list. First question, in 30 seconds, tell us how you got started with ozone therapy.
I'm so short, I don't want anybody to know where the voice is coming from. Hi, Judith Shoemaker here. I have been doing ozone for over 25 years. And I treated an animal, was taught by an older practitioner in Florida who said, oh, you know, you've got an animal with an infectious disease, you need to treat it with ozone. You need to treat a cancer animal with ozone. You need to do all these things. This was a horse practitioner. So I started giving intravenous ozone back 25 years ago. I give it to everything. It makes anything and everything that I do work better. You know, there isn't anything that's not going to benefit by more oxygen in, more toxins out, stimulating NO, stimulating, you know, the vasculature to respond appropriately, and all of the things that oxygen and reactive oxygen species do as part of the immune system. So anyway, that's how I got started with it, and I use it every day in both large and small animals. So there.
How's the lunch, everybody? Everybody's crunching and munching, so we won't ask you any questions. I got started some years ago when I had an incident with one of my horses where I was told there was nothing more that could be done to fix her. And that answer was unacceptable to me, and I swore that I would make sure that I never use those words for any of my clients. So I was always on the lookout for other opportunities, and I was listening to a webinar on the human side with a Dr. David Minkoff, and I discovered that he was about a half an hour drive from me. So I went down to his practice. He gave me a private tour. He's a very big component of ozone, and he encouraged me to do it, and so I jumped in full force, and it has been an absolute practice changer for me.
Hi, my name is Margot Roman, and you know, it's all of you that I learned from. I mean, that's really where I learned from it. So in the late 90s, Marty Goldstein had put in his book, The Nature of Animal Healing, a section on ozone therapy, and I read it, and I sort of like, that sounds really weird and anything. So my own horse got sick in 2003, and Tina Aiken, who was in here, said, Margot, do ozone therapy, because she was working for Marty. And I said, what is that? You know, what is that? How do I do it? And I ended up doing it. And then I talked to Judith Shoemaker, who was visiting, and she said, you got to give him IV ozone. And I was like, okay. So this horse that was supposed to be dead in 2 days lived 2.5 years, but he lived 8 years with holistic care, but he lived an additional 2.5 years and he was rescued as a horse that was dying. So he lived with his cancer for 2.5 years. So I started experimenting on my small animal patients, which is 99% of my client base, and I was seeing miracles. I was seeing things that I had never seen before. And it feels like I potentiate my homeopathics. I potentiated my acupuncture. I potentiated everything that I did because it seemed to add a whole nother energetic dimension that because I'd seen so many other cases before. So for me, it's learning from all of you, and that's how we progress in this organization, is we learn from each other and gain knowledge.
Hi, I'm Al Nunez. I'm in Orlando. I came to the ozone backwards and from not our field. I've been involved in physics and hyperthermia using radio waves for cancer for some time now, for about 10 years. About 10 years ago, I was training some human doctors on how to use some hyperthermia devices. And when I walked in, I recognized a patient that was hooked up, and it was an old yoga friend of mine, beautiful woman, hooked up to a bubbler in ozone. I go, Curdy, what is that? And he goes, oh, that's ozone. I do it on people. I've been injecting 60 people a day IV, notice that, since the 60s. And he showed me what ozone was in people. I was intrigued, and I got a machine, started using it. And anywhere you want to add oxygen, and then the most important thing is something that I want you to take home is this word, heat shock protein 70. Ozone stimulates that through an oxidative stress. It's a repair molecule. You can do it with other ways, other methods, other drugs. You can use it with microwave. You can do it with lasers. A bunch of ways to do it. But this heat shock protein 70 in ozone was huge. And in our cancer patients, the difference is day and night. And it's not just for cancers, for so many things. We'll bubble up saline and put it in bladders. We'll put it up sinuses. I just cleared out different fungal infections and whatnot. All of our surgical fluids, we have a bubbler, and we've got a big syringe, and that bubbler ozonated fluid gets to flush all our lavages, all our wounds, all our orthopedics, anything infected. I just put out a video for the SonoWave where it showed we use ozonated olive oil and microwave only to treat MRSA that a group of specialists had given up on. So where you wouldn't normally see things reacting, you'll see with ozone right in front of you, the tissue change in situ. It's nice to have instant gratification. It does that for a lot of different cases. So I got introduced to it from the human side. And you hear this thing, don't do it IV, don't do it IV, don't do it IV. It's my number one method. I do it IV all the time unless I can't. If I have a line in, it's going IV. And you're not injecting gas, guys. You're injecting ozone. The moment it touches the tissue, it gets sucked in there. And the other thing you want to remember is that it's extremely electronegative. And the body is as healthy as it is electronegative. As your voltage increases, which is going more negative, healthy pH 7.25 to 7.35, that's a voltage of -20 to -25 millivolts. How else are you going to do that? Well, with ozone, you give them that shot and you raise the voltage right away. You see your animal perk up. It's not just oxygen. I want you to remember that. It's not just oxygen.
Thank you. Excellent. So next question here for you guys, and some of you touched on it a little bit, but go into a little bit more detail. How do you use it in your clinic? So your patient walks in the door. Talk a little bit about how often you use it, which patients you use it with, what conditions you're treating, just some of the nuts and bolts of that and how it looks for you in your clinic. What methods of administration you're using most commonly. You already touched on that, Al, but again, just expound a little bit on that issue.
I use it on every horse, every horse. When we finish treatment, even if it's just a performance horse, chiropractic, acupuncture, herbal consultation, lameness exam, whatever, everybody gets ozone. The reason being is it's the equivalent of about 40 minutes of galloping as far as oxygenation goes and the stimulation of the free radical scavenging system. So that's great. What if your horse can't gallop for 40 minutes and oxygenate that well? A lame horse, a laminitic horse, a fat horse. They can't do that. So why not give them the benefit of that kind of exercise? I use intravenous ozone. It's very easy to do. I've never had a problem with it. I have clients who bought their own ozone machines and administered, and I've had a couple of people, hurt their horses because they couldn't do it appropriately. But as I say, I have never in 25 years ever had an inappropriate reaction to ozone. They can, if they're very sick, they've got a lot of virus or they've got a lot of bacteria, you can have a Herxheimer's reaction, but that's, you're not going to die from that. It can be a little exciting. But there isn't really anything that is overly frightening. I can tell you a lot of stories about different types and ways that the animals react, but certainly giving ozone multiple times a day, multiple times a week, it's not been a problem. I use it in all of my prolotherapy solutions in the small animals and have absolutely brilliant. You can do prolozone just with ozone and get really remarkable results in joints. As Dr. Al said, it's great for any lavage solutions. I ozonate all my sub-Q fluids for cats. I ozonate all of my sub-Q fluids for anything that I'm going to be doing. I've dealt with with septic tendonitis, which had been given up on by the university, and done nothing but intravenous ozone and lavage of the tendon sheath and such like that, and had a horse come back as a performance horse with a really septic joint and septic tendonitis. My own horse as well. For small animals, I use it almost exclusively rectally because the absorption of ozone rectally is just about as effective as giving it intravenously. I have tons of clients who buy their own machines and then also will treat their animals at home. We use it extensively in our cancer therapy as it augments the effect of the Santa Wave of Dr. Al's. It augments the effect of almost every treatment that you're going to do. I think it makes my, as Margot said, makes my homeopathy work better. It certainly makes my acupuncture work better. I use it in combination with multiple modalities, including the Santa Wave and a beamer technology. I have treated grade 4 mast cell tumors in the lungs and the liver and throughout the abdomen with nothing except ozone, Chinese herbs, and had complete remission. Dog was given 2 weeks to live, full of fluid, coughing, not able to breathe, and the thing resolved within 2-3 weeks. All the mast cell tumors on the outside were falling off, all the ones on the inside exteriorized to the appropriate space. Gave the dog some fluids for a couple of days, kept on ozoning. Well, I slowed down on the ozone because I didn't want tissue kill to be as quick as it was. So, but again, and the dog's still alive 2 years later. So, and just everything's gone. So again, ozone is a very powerful anti-cancer tool, anti-infective. Nothing's immune to it, as far as viruses or anything else. So it works well in conjunction with it. Not much that's not going to be as well, doing it with more oxygen. Okay, repeat the question. Okay, how was it administered for the mast cell tumor dog? It was a 14-pound Jack Russell, and she started out with a rectal ozone every day. Owners bought a machine, rectal ozone every day, and then after a while, we went to every other day, every third day, and bagged her because she had a lot of cutaneous mast cells. She was 300 lesions and itched and take 40 milligrams of Benadryl just to, be able to function for 4 hours. So she's on no Benadryl, no chlortrimeton, nothing now. But bagging, now she does bags every other day, rectal every other day, and weekends off.
That was a fantastic summary. So I'm going to approach it from a little different perspective. I want to help you understand that ozone is a tool. And we have a toolbox in our Western world. This is one of the tools in our Eastern world. And all the tools are important, and they're all very good. They're as good as the practitioner who is using them. So I'm going to back up a little bit and help us to realize that as good as ozone is, and it is amazing, we can't miss the fact that the first thing that we have to do for our patients to get them better is stop doing the things that are causing the disease. Okay, so we have to stop creating the pollution through species inappropriate diets, through toxic water, through toxic environment in the home. You can't get past that. We have to make sure that the essential nutrients are in the diet so that these animals can take the things that we're giving them and use them. We have to make sure we heal the leaky gut. We have to make sure we're working on organs of detoxification and we're helping to facilitate these animals to detoxify. We have to make sure that we're turning on the mitochondria so the mitochondria can do their job. Now, why is ozone so important? It's because ozone affects 3 out of those 5 pathways. It aids in detoxification, it aids in supporting more oxygen getting into the tissues, so it helps the oxidative burst, and it also helps to support the mitochondria to make more energy. So, keeping that in mind, I'm going to be doing 3 hours of lectures on Monday on ozone. So I'm not going to steal the thunder, you're going to have to show up to the lectures, but I'm going to present a ton of cases and usages so that you can really see it in action. As far as how do we use ozone, again, we use it on almost everything. The ADR dog, where you're just not sure what's wrong, but they're just not right while you're waiting for your labs and such to come back. An amazing opportunity to do rectal ozone. You can do no harm, and you can only do good. And these animals are going to start to feel better, if nothing else. We use it subcutaneously. We use it as a lavage. I'll show some cases on Monday of really severe burns and how effective ozone was in keeping those wounds sterile and keeping the animals happy. I think another thing that we want to point out is how fast they heal with ozone. We all have had successes without ozone, but when you start adding ozone into your formula, not only do you see them get better faster, but more effectively. I've used it in eyes. We use it in all of our oral surgery cases as a lavage for periodontal disease. I use it myself as a periodontal wash. So whenever we make a lavage up a ozonated saline, I'm going to go ahead and put some in my mouth and swish it for 30 seconds and then spit it out. For vomiting, diarrhea, it's fantastic. Of course, you're going to follow the other principles. You're going to get your diagnostics. You're going to find out what's going on. But it certainly helps to aid these animals in feeling better and getting the problems under control. Ear infections. Raise your hand if you've ever had that ear infection that just won't go away. If you didn't raise your hand, you're lying, because I've done it for 37 years, and there's always that animal that it comes back and you see their name on the schedule and you go, oh no, it's back. All right, so I'll show some cases where in 36 hours we have a negative ear cytology. Not always ozone by itself. Sometimes we'll use it with a laser, and oftentimes it is part of our therapies in the toolbox, but I have a big, big alternative toolbox. What else would I use it in? We talked about wounds. We talked about infected wounds. We've talked about ear infections, eye problems, vomiting, diarrhea, and of course, our cancer patients. So ozone is so versatile. It can be used as a gas. It can be used bubbled through saline. It can be used directly. It can be mixed in with blood and given back to the patient either with or without UV radiation adding to it, which is another, the photodynamic therapy is another whole kit and caboodle. So it's real effective that way. It can be used mixed with blood as a homeopathic remedy where you're doing it as an autosanguineous injection, so you can go right into tumors. I've lavaged abdomens with it. As a saline flush, I put it into the chest where there were tumors. I've used it on patients that had autoimmune diseases. I've used it on hemangiosarcomas and immune-mediated thrombocytopenias, which if you asked what is the only contraindication, it would be with bleeding disorders. So you have to use a little more judgment and a little more care when you use it, but you can use it. Any questions? Oh, bladder infections. This is wonderful. You can infuse it right into the bladder as a gas, or you can do it as a saline flush. And for our female dogs, I'll be the first to admit I really suck at catheterizing a female dog. I don't think I've ever done a female cat. And so we'll do it through cystocentesis. Make sure the animal is asleep when you do that, because it does sting and they will leave your table very quickly. I got that through experience. All right.
Yes. I mean, adding to them is adding it to your practice, and some of the things that we've been doing, we started to do a summary of it. We've done over 25,000 ozone treatments at my practice. And I'm trying to write a book with Zule Zamaro, who wrote the ozone therapy book. And any of you that have cases that you want to include in the book, we're including anyone's cases that can show us how, because we want it to be a universal international book. So just as a piece, if just you can get in touch with me. But the cases that I've seen is everything that comes in, if you can do something that can bring down inflammation and you haven't done any damage to the animal, why not do that? So it's any of these animals that come in and they have Lyme disease, or they have cancer, or they have autoimmune disease, or they have allergies and skin allergies and ear problems. You can just use ozone and it reduces your inflammation right away and it gives you a chance. And there's a bunch of other tools that I'd use, and I'm happy to share them with everybody. But it's one case I really think nails it for me. And this is a case that if this doesn't convince all of you to get ozone therapy, then, and this just happened May 20th. I had a dog that came in. The owner I knew, but I didn't know the dog. It was moribund. They carried the dog in, and I had seen her at our election, and she said, my dog's going to be euthanized at my vet today, and it's been dying for the last 3 or 4 days, but it was sick 10 days ago, and they want to do $1,800 worth of lab tests on the dog, and I can't afford it. She brought the dog in. It was moribund, subnormal temperature. It was a female, and she was unspayed. So I thought, you know what? Maybe she has a pyometra. And she made this little comment, there's a discharge from the vulva. So in 20 minutes, I had the dog on the table, made my little incision, pus comes pouring out of the abdomen. Pouring out of the abdomen. And I, made the incision. I said, the owner's in the other room, and they don't have the money to do the surgery, let alone send them to an ER to be put in there with drains and everything else and be cared for with cultures. And so I didn't tell them. They were in the other room. I didn't tell them. I figured they would tell me to euthanize the dog on the table because I would have euthanized the dog on the table. Peritonitis everywhere, okay? Took the omentum out. I flushed the omentum, took the uterus out, flushed the abdomen, did UVBI intravenously, a vaginal flush, did 2 homeopathic remedies, a 10-M arnica and a Bellus paranus, and did acupuncture on the dog. The dog went home 5 hours later. 5 hours later, like a regular spay, okay? The only antibiotic I had in my clinic, because I don't do a lot of antibiotics in my practice because I really treasure the microbiome, was injectable amoxicillin. So went home on injectable amoxicillin. Sent them home with pain management. They never used the pain management. They never used it. They didn't really need the antibiotics, but I thought, I have to do antibiotics. With a pyometra like that. So I sent it home on Clavamox. The next day, we did intraperitoneal ozone injection gas, IP gas, okay? Within that next day and that afternoon, the dog's walking around almost normally. The following day was walking around normally. I have it all on video. It's on my website, mashvet.com. You can watch the surgery to everything and I wrote letters to the AVMA and to everyone. We have nothing that controls pain like that is not going to be some damaging in some ways. The opiates that we have in this country are killing us, okay? And the NSAIDs are killing us. To not have to use that and just to use acupuncture and homeopathy and ozone and to get that kind of infection. So John DeJong from the AVMA said, Margot, things take time and you got to have double placebo blind studies. And I said, listen, a pyometra is a pyometra. We don't have to do a double placebo blind study to show a ruptured uterus. The uterus had ruptured 72 hours before. There were adhesions on the uterus that I talked to a human forensic pathologist who said the adhesions that dog had meant the uterus had ruptured 72 hours before. To control infection with something this day and age, antibiotics are from the 1900s, right? We have a tool like ozone that actually can bring the inflammation down, can treat the animal's whole immune system, and get rid of the bacteria. Not only are there bacteria in our body, but there are phages and mycoplasms and this whole microbiome. That is the part that I feel like I want to talk to you about, is the microbiome and the relationship between ozone. Ozone kills phages, macrophages, viruses, and all that on contact. And so by using the ozone prior to doing a fecal transplant, which is what we do, we're knocking out that biofilm and then doing all the things that they're going to talk about, which is, reducing inflammation, bringing circulation, stimulating the mitochondria, which stimulates the stem cells within the colon of the columnar cells, in the columnar cells, and detox the liver. So it's just a win-win thing. So all of you that are here, I really encourage you to do ozone therapy. Take classes. There's online classes. I've got an online class. We've got it from O3Vets. There's ways of learning. It is not hard to learn. It's just an adjunctive thing that you can add to your practice and not really have to learn any other skill sets. Bladders, it's easy peasy on interstitial cystitis. Gone in a day.
Margot's fecal transplant, so I want to add to that. If you do ozone prior to a fecal transplant, it just improves the take. And there's studies that show, again, remember what I mentioned, heat shock protein 70? You'll hear it like a mantra from me. If you stimulate heat shock protein 70 in the gut, it codes for good bacteria and kills bad bacteria. So when she's giving her ozone prior to a fecal transplant, she's ensuring that what she's giving is not only the proper biome, but she's knocking out the bad guys prior, and setting up an environment so that the good biome can take over. It also happens if you just stimulate heat shock protein 70, but why not? If you've got ozone, use it. You know, I was thinking about something that I wanted to mention that I don't know if we mentioned it. It's, you know, we've mentioned, all right, so IV, which is controversial, not for me. I use it every day. They have also. All right, then there's, you can put ozonated salines IV, all right, so you charge up your saline. Why just give Normasol? Well, actually, don't do Normasol, saline. Why, don't use Normasol, because after a while it oxidizes some of the minerals in there, so you'd rather use saline. But you give your saline, and you're giving now potentiated saline. It's not just saline anymore. It's saline with oxygen and extremely electronegative. That's why these animals are getting up. So that's one. You can do it sub-Q. What is it? Intramammary. You can inject it into the teats. And then there's different charts. There's just different concentrations. When you're going to do it IV, when you're going to do it in a saline and you're wanting to charge your fluids, you crank the machine up. That's the highest concentration. When it starts going into your normal use, say into an organ, into a bladder, into a mammary or whatever, I think it's gamma 5 on my set is what, like 36 or something, gamma 36? There's a chart. But basically, the more sensitive the organ, the lower the concentration. Like you can actually ozonate lungs. We'll do that sometimes. But you have to do it special. You have to put it on the lowest setting, bubble it through water, and then bubble it through olive oil for a surfactant, and then let them breathe that. That lets you use it for lungs, and you just nebulize it, basically. But it has to be the low concentration, and that's the only condition where it has to have olive oil that it bubbles through for the surfactant. Everything else, it's, okay, what did I do the other day? I have a Pseudomonas infection from somebody else for like 5 months, and they came to treat, and we did a culture. It's Pseudomonas, resistant to a bunch of stuff. It's sensitive to Baytril and Clavamox because it has like 3 bugs growing. And what I just did Friday before I came was ozonated it. We sedated the animal and neti potted him. We basically got a big ozonated syringe, 60 cc's, got a Tomcat catheter, went up to the nose and just started flushing that neti potting. You see all this goop just start to come out, you know, right away. And then at the end, the bleed, which was good, you know, going, okay, we got the clear tissue, we've got the whole scenario here, and actually seeing the animal respond quickly. The one thing I want to mention that's my best friend is ozonated olive oil. You can either buy it, some people make it. The scenario is I just treated a case of a mast cell tumor that had not, that was taken off at our local specialist. I have a lot of local specialists. We're a pain in their ass. So scenario is, what happened is they took out the mast cell tumor, got MRSA, resistant to everything. The client got frustrated with them. After 2-3 attempts, they had removed the tumor over and over to try to cut out the MRSA, et cetera. She came, and the first thing I did is I looked at the culture, and I said, oh, my God, it's resistant. The ones that growl at you, everything is an R, goes, Rrr. So that's how you know it's bad. If the culture growls at you, you know you're dealing with an ozone. You need ozone. So what did I do with this woman? This was the... just lost my train. Anyways, with this particular case, ozonated olive oil, thank you. The thing with it is all I did was hyperthermia once and ozonated olive oil, and 5 days later you see the wound. That picture's on the website. And one, it looks like it's rotten, and the other one, it's already granulating. And then we used no antibiotics, just ozonated olive oil and 3 total treatments of hyperthermia over a 60-day period. So it was day 1, day 2, then every day they were doing the ozonated olive oil. And you see MRSA to shrink and heal by second intention with 0 antibiotics. No antibiotics. I'll say that again. No antibiotics. What is with the antibiotic? It was ozone and hyperthermia, both. The bugs don't like fever. When you use that combo, boy, do you have a tool. Where before you look at stuff and go, oh, I don't know, refer that. Now you know that when you refer it, they may not have the tool to treat it like you're going to. So I have no problems keeping those in-house because we do, frankly, a much better job. And I'm seeing that because we're getting the cases when specialty says uncle, that's where this takes over. Where else? It's joints. You can inject joints. Oh, limb bagging. You can get a bag and stick the really bad pyometria. You can put a bag around the leg and ozone the bag and fill ozone around the leg and hold it there for 15, 20 minutes and then release it. So there's a bunch of, there's limb bagging, what else? In the ears, flushing ear sinuses, every hole. Name a hole.
No, wherever you can put fluid, you can use ozone. Or gas. I mean, I use a lot of ozonated saline, so pretty much we have 3 ozonated saline makers running all the time at my practice, and we roll them in, and we give it sub-Q, or we bag a foot with ozonated saline, or we, give, and working it with acupuncture, my feeling with acupuncture now is that we have to get circulation to the fascia. And if I can put ozonated saline under where I'm going to treat the back for back pain, and I flood that ozone in the back, bring oxygen to the fascia, then put my needles through there, I'm potentiating what we're trying to do with acupuncture, which is to bring circulation into an area. So we're just potentiating every part of what we do, and that's why adding the acupuncture or adding any modality to the ozone, you're just getting more oxygen in the body. We live in an oxygen-deprived world now. You notice the CO2 levels in our world have elevated. Cancer loves CO2. It loves to be in a fermented environment. And here we have an opportunity to give something oxygen and give the body a chance to be running 40 minutes in exercise and getting that circulation. So it's a great tool.
So if you have a question at this point and you want to ask it, head over to the mic. I'm going to let them comment a little bit more if I think there's a few comments. But again, we're going to open it up for a few minutes here with questions. So jump over there if you want to.
Thanks. Okay. We're all looking for tools that are safe and effective. And I think that ozone fits that bill. It's also very cost effective because it's not expensive to use. It's not even expensive to buy the equipment for it. The learning curve is the shortest of any modality that we have out there. Who does thermography? Raise your hand. No one. Couple. My daughter, of course. So thermography, ultrasound, even radiography. I still send some of my films off because sometimes they're hard to read. With ozone, the learning curve is very, very short. Probably 10 minutes, you can be effective in a lot of different modalities. And more important than that, it's a technician-run duty. So this is a doctors-free modality. All you have to do is tell your technicians what it is that you want to treat and how you're going to have it treated. But technically, other than doing joint injections, your technicians are going to do almost everything else. And then I'm going to comment on the injections of joints. We see a lot of cruciates these days. Yes or yes? A lot of cruciates. Okay, I think we're seeing more cruciates and degenerative disc disease than we have ever seen in our practice. Remember the days when we used to be so tired of seeing flea allergy? Now it's chronic back problems and joint problems, and we have harder cases, and that's a good thing. I have cases where the owners either didn't have the money to do surgery or for whatever reason didn't want to do cruciate surgeries. And we'll inject these joints with a combination of prolotherapy and ozone. And we have videos that I'll show on Monday. These dogs walk out of our surgery room. They are weight-bearing, they are not painful, and it lasts. So something so effective and so easy to administer, we should all be doing stuff like that.
I think one of the biggest things, everybody's mentioned it, but I want to make sure that everybody's really clear on the fact that this is profound humane pain control. Pain mitigation is probably one of the most important things that I think ozone does. And in addition to that, you can use your ozone machine for environmental things as well. Ozone's heavier than air. You've got rugs that smell. You've got rugs that you think, immersed dogs walked all over. You've got, different things going on in your clinic. You can use ozone and different types of ozone generators, both, ones that are medical generators, but also ones that are environmental generators to really make your environment much cleaner and smell better. And so we've used all different types of ozone generators for everything about our practice. And it's really quite a remarkable thing to do.
Okay, let's jump back to one of the questions.
How are you charging for this?
Personally, I don't charge a whole bunch because I want people to be able to utilize it. I want them to come back. I want to see them as often as necessary. It also, even though I charge like between $30 and $35 for a small animal rectal ozone and $55 for an IV ozone on a horse, that's basically my charge. But the point is that if they're coming in for it, then you're going to be able to catch other things that they need to be paying attention to. You will generate other income all by itself. My ozone machine paid for itself in the first month I owned it. Absolutely. And it is just such an amazing change, too, because it brings the client back because they can see the change instantly. An animal walks in looking like it's headed, like she says, moribund, or you can tell that it's going to walk out, that it's going to get worse if you don't do something. You give it ozone and you flip it over the edge, and it starts to heal. It starts to kill its cancer. It starts to get a handle on the infection, and the change is dramatic enough that people really appreciate it. Do you use it for health and wellness? Absolutely. No horse walks out of my office, even if it just came in for a Coggins test. It gets an ozone treatment. Seriously, I'm not kidding. I'm not exaggerating. Any amount of ozone makes a difference. Yeah, any amount of ozone makes a difference. What's the frequency? My experience with that was I used to use ozone only as a last resort. I would use it in really, really sick animals. And I found when I went to a certain barn, she had a talent for adopting sick animals, so I ended up treating every animal. And she had a problem with, she thought maybe they were going to get sick because there was respiratory disease in the barn and stuff like that. So I just gave everybody ozone, whether they were sick or not. I was trying to ward something off. I came back 6 months later was how often I visited her barn. As a whole, those horses were better than they had ever been after one treatment. So that was once every 6 months. And then I would stay at her farm for 2 or 3 days. So I'd ozone everybody, 3 days in a row. And all of the stuff that we would nurse on, and I would call her on the phone, I didn't have them. I thought I'd lost her as a client because she usually called me back all the time because, people weren't recovering. They all recovered. They did well. It was a 6-month visit were wellness visits instead of illness visits.
I'm sorry, we have to move on. So basically she's saying it'll put you out of business if you get ozone. We need to move to the next question. Is there something that you have to, okay, answer it quickly.
So major autohemotherapy, where you're drawing blood, ozonating it, and then putting it back into the animal, we charge $130. That includes our catheter. We are doing UVBI with that, so they get the whole kit and caboodle. It's $130 per treatment. We'll typically do 1 a week for our cancer patients. For rectal ozone, we charge $35 per treatment. If we're going to be doing multiple times, we're going to maybe give them a discount. And if we're doing a lavage where we're flushing ozonated saline, we'll usually charge between $15 and $25. Now keep in mind, we've done a thorough workup, so you have all of your fees that you have made on your diagnostics and making sure that you have a good diagnosis, and then you have your treatments, and then you have your follow-ups. So there is quite a large ROI with that.
So once you've ozonated the saline or the olive oil, how long does it stay ozonated? Is it practical to send someone home with ozonated oil or water to use at home?
Okay. Ozonated oil will last for years in your refrigerator. So have it. Every one of my clients pretty much have ozone oils in their refrigerators. And what I tell them is to buy the large container and then take a spoon, dip out what they're going to use for that dog, put it in a plastic bag or something that you want to transfer it, because it's for the whole family, and you don't want double dipping, rubbing this on the dog's anal gland and then rubbing it on your teeth, you want to be able to use it on all different surfaces, and they use it for their gums because it's really been more used in human medicine than it is in veterinary medicine. So the oils everybody has. The saline, we bubble the saline, and it's supposed to only reach 37 micrograms per milliliter at like room temperature. And so what we do is we used to send it home in plastic. In plastic, it breaks down and starts breaking down in 30 minutes. So they give you about 30 hours. If I refrigerate it and I send it home in glass, I tell them to give it every 6 to 8 hours and give them a certain dosage that I recommend for that pet. But after 30 hours, you're just giving them sterile saline. So there's no negative. It's just not a positive kick. So if I'm giving a treatment in the clinic, we get the glass bottle, and the glass bottles, for those of us been in practice, we used to be given those glass bottles. Now you have to pay like $15 for a glass bottle. So we use the glass bottles, and they bring it back, and we keep refilling it because it's sterilizing it. So they buy 1 bottle, we bring it in, and they fill it for the 4 treatments or 3 treatments, depending on if they're doing it right when they walk home or get home. and then they keep it on ice in the refrigerator, and they use it every 6 to 8 hours, and it's wonderful to be able to send it home. Most of my clients now are buying ozone machines, or not most of them, but many of them are. O3 has a little one called the Hummingbird, which is very easy for clients to use, and it's very simple, and he's got videos and everything else that they're using, and it's a really nice little machine. My daughter has one. My other daughter has one. I just got them from I just sent everybody, you need one, So, but they do it at home, and that is, to me, is empowering your clients to have a source to do something at home and get the animal better before you get in there is really nice. I mean, I like to empower my clients to have sources and resources. Rectally, yes. So some of my clients have bought saline makers or saline things, and then they suck it up in a syringe and they give it under. I don't have anyone who's actually bought the glass saline maker, because it's expensive. We make it up in the saline maker. I would recommend every veterinarian getting a saline maker. It's so much easier than sucking it up and doing that. Yeah. Okay.
Have you ever tried it on the degenerative myelopathy patients?
On what?
Degenerative myelopathy.
Yes. It's the same thing. Heat shock protein 70 is a repair molecule. You will produce it by giving an oxidative stress. Every time you give that heat shock protein. While you were talking about the horses that they work for so long with one treatment, and I saw your eyes, and I went, yes, it's true. Why? There's an initial insult when you give that ozone, that then the body produces a protein called heat shock protein 70 and 90 and 27 and 46. Please remember that. Go look it up. That's a repair molecule. You're stimulating the body to repair itself. So when she gave the ozone, that wasn't it. She got oxygen, it got increased electronegativity, and then it forced the horse's physiology to make a protein so it could heal itself. That's ozone and hyperthermia.
Okay.
Might blind you. Okay. First of all, I want to help me thank our panel here for their time. Really, thank you guys for doing this. I really appreciate it. And secondly, I want to thank you guys for being here and for just being a part of this. We do have, as O3Vets, we are the only company that is doing ozone therapy for animals, at least that I'm aware of in North America, that's focused on specifically on animals. So your options are really limited. I'm sorry. But anyways, we do have an offer for you here at the conference. Basically, if you come by our booth and you just want to know a little bit more about what is available equipment-wise and how it works, we'll be there, of course, to help you through that process. But we've only been around 5 years, or so, and Margot, helped get everything started, and Marlene has been a huge asset to getting things and training-wise just really solidified. And I want to thank Judith and Al. I don't know as well personally, but I know you guys. The reason I wanted you here because I know you know a ton about this, and it's really helpful for me to have people to rely on because I'm not the expert. So thank you for that. But we have developed protocols, videos. We're really close to releasing our online video training program, which is a certification course with tests and certificate and everything. So that is going to be available. We do have a number of other things that we do and a number of products from ozonated oils to creams to the generators to all the accessories you'll need. And we do stuff online as well. So if you can't get out, just because you don't have equipment yet doesn't mean you can't get started. In fact, I don't think Gary's in here, but he was in our training class yesterday. And he bought all his equipment a year ago. We did an online 3-hour Kickstarter training for him, and he just went for it. And he was telling us in the class, it was great. I had everything I needed to get started, and some people need a little more than that, some don't. But so we have different things available. Our guarantee is if ozone therapy doesn't become one of your favorite treatments, we'll refund your money and treat you to dinner. So I will not come to where you are. We'll send you a gift card, though, for something. And so that's our guarantee to you. And I'd love to talk to you more. Again, there's some reference cards. If you want one of these sample packs, I have a bunch of them, but you have to fill out a reference for us to grab one. So I think that's it. We are done.
We really all need to stop and have a moment of appreciation for Jonathan, because as a company owner, he is so dedicated to the veterinary industry. His heart, his passion has been committed to helping us help our patients with this technology. And there's not that many companies out there that are that committed, particularly on the education side. So thank you, Jonathan.
All right, I think they're going to boot us out, so you guys better get moving here. Thanks.